This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So, good morning. How are you?
Feeling great. Thank you.
Good. You're looking great too.
Thanks.
So many men are calling the office now.
Yeah.
And men have always called the office because there's some really sweet men that are married to patients that actually call the office to refill their wives' prescriptions. So that's a bit of conversations that I have with men. But now we're getting men calling because they want to take a deeper dive into their health for whatever reason. Maybe they're struggling a little bit with weight, or maybe it's a little erectile dysfunction, or they're just not feeling right. And it's nice talking to them, and you're doing a lot of great things for these men. So I wanted to kind of go a little bit deeper into that today.
Yeah, it's definitely increasing. Being a gynecologist, and the vast majority of my patients are women, and we've been dealing a lot with menopause and sexual health for them, and resolved a lot of issues for these patients that their husbands sometimes are left a little behind.
Yeah.
And so those are people that call the office. And then there are other males who are just interested in increasing their libido, their energy, or perhaps even their fitness, and are looking for testosterone. So there's a wide span of patients' symptoms that we have to look at. Again, and I say this repeatedly, that the podcast has educated me in what needs to be done for a lot of these things, a lot of these people where I wasn't looking as deeply as I should.
Yeah.
And so, again, the phrase medicine 3.0 comes up before people have much in the way of symptoms. So what's the ideal way of looking at this? So my approach is to, first of all, talk to the patient. And this may surprise people, but the most efficient way of dealing with these patients and treating these patients is to first have a brief 10-minute phone call about what's really bothering them. What are they looking for? Mm-hmm. And then I can work out some imaging, some lab work, some testing prior to them coming in for a consultation.
Right.
And it means that we're saving time that way. They're not coming on and paying a significant amount of money for a consultation. And I say that, well, we've got to look at other things. These are things that we're now doing. We've changed that through the education I've had through the podcast. So what we're doing is more extensive lab work than we were before, which has included lipids, but not just a general look at the cholesterol for patients, but looking at specific parts of it that can be a warning sign before anybody becomes symptomatic.
Yeah.
But also can be looking at blood sugar. So we're looking at the areas that are the most threat on our health or their health or the male's health. And those are cardiovascular disease, cancer, diabetes or errant glucose metabolism, and neurological disease. And I would add to that bone health. So if we look at all of those things, we can do blood tests for these things, and get an understanding of where they are. We'll check hormonal levels as well. We do these tests fasting. We're looking at those things with a blood test. Then I see the patient and we talk about other things. And we go then, depending on what we've seen, we might do more extensive blood testing. We may repeat some of it. We may then do some imaging. If somebody's interested in weight loss, we want to really quantify their issues here. Should we do a total body composition looking for visceral fat, which is a danger sign for a lot of people that are overweight? And that gives us a lot of information. Also tells us about their bone strength. And along that line, we have another method of doing bone testing using the bone score, which is a newer FDA-approved test for bone strength or bone susceptibility to fractures. Because that, and it's not usually looked at as one of the major causes of death, but it is. Because if people are incapacitated by having a fracture, particularly a hip fracture, their health goes really downhill very quickly, just because they're not up and around. I know, you see it all
the time. Yeah.
So then we will look at genetic testing as well. The cancer way we can look at with Gallery, which is a phenomenal test, looking for just the faint, slight evidence of a cancer, and being able to, in most of the cases, be able to pinpoint where it's coming from with a high level of accuracy. So all of those things we do, and then we give them some advice. Sometimes it's going to be you need to see a cardiologist. Sometimes it could be you need to see a rheumatologist or a neurologist. And what about a quantitative EEG, electroencephalogram, looking at cerebral health? All of these things are really important, and that's why let's do the basic work in the lab before the patient comes in, and have that conversation before the patient comes in, and then we're in a position to guide and direct with that consultation and send them for the additional studies that they want to do, and look at this over a period of months. You know, just, is this something we're going to, it's going to take weeks to get all this information, and then we want to see what you're doing is working. Am I sending you to a fitness lab, or am I sending to a physiologist? And this is really the way to, I believe, to look after males who are really interested in increasing their health span.
Thanks for listening. And if you have more questions, please let us know, either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.